could define how you see participatory practice.
Well, certainly that launches us into the chapter itself, and we're not going to be making any assumptions on this call about whether or not folks, the 210 of you that are on the line at this moment, have actually had a chance to read the chapter yet. So I'm going to do my best to maybe just summarize some of the main ideas that that Jane and I have tried to convey by putting our heads together. So the first thing I would say on a call like this would be to confess that my definition is probably inflected by my own role as an academic researcher. I think that obviously places me in a little bit of a different circumstance than many that are on the line right now, although not everybody. Following the first line in our chapter, I would start any definition of participation with an acknowledgement of its roots as a fundamental democratic principle and obligation. All of us on this call, I would suspect, are public servants in a manner of speaking, and we're all at the same time a part of a wider body of citizens in the world, in addition to our roles as health promotion professionals or public health professionals. So for me, I think participatory practice is a commitment to be authentically engaged in relationship with that world and as well democratically accountable to the people who are directly impacted by the work that we do. And which for me as an academic researcher is really about inquiring into the conditions that impact the health and well-being of certain groups of our fellow citizens so that we can look together for ways to change those conditions. The second thing I'd say is this is more than a commitment to some kind of process or procedure or maybe a method in research terms. To be participatory is integral. It's an integral part of not just what I do, but of who I am and who I think I aspire to become. So it's more of an ethical commitment to me to be transformational, which is the first word that you see on your screen there. Not just for the world around me, but for the world in which I am a part of myself. And when we say transformational, it's not in the sense of that there's a before and an after kind of thing, but transformation is rather a continuing process of change and recognizing that change is a continuing process that's inherent in our society and in our culture. So the transformation I think we're after in participatory practice is one that moves us towards more interconnectedness, towards more social and environmental justice in the world. More specifically for me as a follower of the more critically oriented tradition of participatory practice that students usually trace back to the roots of folks like Paulo Freire and anti-oppressive pedagogy more generally. What this means to me is that I try to actively contribute my energies and my experiences, not just as a researcher, but my worldly experiences, as well as my expertise, directly in support of people and within places that are faced with what I would consider to be unjust conditions. Those are things that impinge on people's fundamental rights, including their right to health. And of course, the right to health is connected to other forms of rights, including well-established legal rights, but also rights that we might think are recognized in principle, but aren't really fully realized in practice. The ones that concern me are, of course, the right to housing, the right to food, but of course, the right to any other social determinant of health. And of course, also in Canada, such injustices and the lack of recognition are connected to legacies of racism, colonization, but also are connected to significant and ongoing struggles and achievements, those that have come before us, those that are working for our rights today. And so as a participatory practitioner, I think it's important to recognize those achievements and those struggles in the work that we do. Translated in terms of public health, this is what we might call equity-focused research and practice. But of course, for me, the term equity is, in some ways at least, a professionalized euphemism for social justice. Another way that people think about participation is by the often said distinction between being involved in research with, not on, people in the community. And there's nothing wrong with that distinction. I think it's a really important distinction to make, but I think it's a little bit of an oversimplification, or perhaps maybe it's just half the story. So what I would offer today is suggest that I think that there should be more emphasis on defining participation in terms of self. And that's where Jane and I go into the idea of participatory thinking in terms of asking questions of ourselves, like who am I, what are my responsibilities, what resources do I have to offer, importantly, what limitations do I face in my workplace, in my set of expertise, my knowledge, what limitations in my personality, and maybe most importantly, what risks am I willing to take if I'm going to try to act in order to position myself and the work that I do within potentially fraught political spaces alongside communities that are facing oppression. And those kinds of questions aren't limited to research, of course, and I don't imagine that many on the call would disagree with me that research is merely one form of public health and health promotion practice more broadly. Maybe one distinction, though, or an advantage that I have over people who work outside of the academic sector, whether that's in public health units or health centers or community nonprofits or even the private sector, is the degree of protection and relative autonomy that we academic researchers have to take the risks that are needed to do this authentic engagement within the politics of everyday life. So dealing with those constraints, I think, is one of the luxuries that I have, and I know that I would be curious to know about learning more about those kinds of constraints in the work that others do and the institutional context that they do. Moving down that list, another way of thinking about the ethics of participatory practice is to get out of the mindset that sees the self in an individualized way and towards one of valuing the importance and place of collective wisdom and collective ways of knowing that are created through relationships between people, between people and places and the land, and directed towards the just transformation of society. So this entails an orientation to what we call co-learning and consciousness raising that requires that we take a learning perspective on our part as much as those with whom we tend to lend our time and energy in our work. And what I would recognize in adopting such an orientation is how much I depend on the support of the world around me in order to accomplish the small part that I take responsibility for. So being participatory isn't really a question of what I do or what we do, but rather who we think we are in this collective world. Insofar as how, for me, it's how I see myself, my privileged position in the world, my institutional and professional status, even my own career motivations, the things that occupy my days, Monday to Friday, in the office that I'm sitting in right now. And to think about those things in relation to those who surround me in my work and who I depend on to do my work. And so this is somewhat of a political commitment with all the risks that come with it, as much as it's a philosophical commitment. And then lastly, and again following Frary, to be participatory is to take a different position on what we see as the objective of what we do as researchers or practitioners. It's always and definitively to be problem posing in our orientation to research practice rather than problem solving. And that's an important distinction to make. For me, I don't take, for example, I don't take as a starting point a particular issue such as a particular prevalent health condition that's affecting a particular group of people or an area, and then approach those people with a desire to solve that. But rather, to be problem posing, at least for me, is to start at a specific place in the world and then turn this place into a starting point for a continuing conversation and process of relationship building that seeks to look deeper and deeper into the problems that underlie what might be visible at the surface. And when we do that, what I often find is that participatory practitioners end up becoming very, very interdisciplinary in how we think about knowledge and how we think about our responsibilities. And I think that, for me, that is increasingly taking me actually back to methods, because there's, contrary to maybe what some assumptions, there's no defined set of methods that we would call participatory and others that are not participatory. In the work that I do, increasingly we're embracing all kinds of different approaches to knowledge generation and knowledge practice, including things that we would recognize like interviews and focus groups, but also mapping, GIS mapping, poetry, history, et cetera, et cetera. And so the methods that we decide on tend to be predicated not only on the problems in the world that we encounter, but on the capacities and priorities of the people and the places that we inhabit. So that was all a little bit philosophical, and I guess we're meant to turn to how to go about implementing participatory practice. And I think I can advance, I guess I can advance the slide, but we've got a couple of examples, I think, that Jane is going to share that helps us to sort of cement these ideas in examples.
Yes, thanks, Jeff.